Hi guys, my name is Shay and I'll be presenting human growth hormones. So a quick table of contents as to what we're going to be covering is an overview, effects on the body, risks and potential consequences, and how human growth hormone is used as medicine. So a quick overview. What are human growth hormones? Human growth hormones is a natural hormone your pituitary gland releases that promotes growth in children, helps maintain normal body structure in adults, and plays a role in metabolism in both children and adults. What triggers human growth hormones? Your pituitary gland normally releases human growth hormones in short bursts, which are known as pulses, throughout the day. The release of human growth hormones is mainly controlled by two hormones, your hypothalamus, which releases human growth hormones, and somatostatin, which prevents human growth hormone release, which is where you notice these pulses come in. One is releasing and one is preventing it from releasing, which is where you'll notice the pulsing. So, human growth hormones' effects on the body. Human growth hormones promote growth in mainly every tissue and organ in your body. It's most well known for its growth-promoting effects on cartilage and bone, especially in the adolescent years during puberty. Once the growth plates in a child's bone have fused, human growth hormones no longer increase height. Instead, it helps maintain normal body structure for the rest of your life. Human growth hormones also impact metabolism primarily by increasing the production of insulin-like growth factor 1 and its effect on cells in your body. So to the right, I included a little visual to kind of help put that into play. So you can see up here the pituitary gland is sending those pulses of the growth hormones to the muscles and the bones and the liver, which then promote the growth for them, and that's why we grow the way we do. So, risks and potential consequences. So what if human growth hormone is too low? Well, this affects adults and children differently since they are at different periods of growth. So in adults, it leads to reduced sense of well-being, increased body fat, increased risk of heart disease, weak heart, muscles, and bones. And in children, it leads to a younger looking face than what's expected for their age, impaired hair growth, and delayed puberty. So what causes low human growth hormone? In adults, hypopituitarianism that results in human growth hormone deficiency may develop due to a benign pituitary adenoma, which essentially is just a non-cancerous tumor or damage to your pituitary gland or hypothalamus. So in children, hypopituitarianism that results in human growth hormone deficiency may be present from birth, where the cause can be unknown, genetic, or due to injury to the pituitary gland during fetal development or birth. So essentially, if anything is harmed with the pituitary gland or anything has gone wrong relating to the pituitary gland, it could lead to low human growth hormones, since that is where it comes from. So, how is human growth hormone used as medicine? Human growth hormone as medicine in children is used to treat growth hormone deficiency, conditions that cause short stature such as chronic kidney disease, Turner syndrome, and Prader-Willi syndrome. And then in adults, it's used to treat growth hormone deficiency, loss of muscle tissue from HIV, and short bowel syndrome. Like all medicine, there are some side effects to be aware of. So side effects for synthetic human growth hormones is carpal tunnel syndrome, increased insulin resistance, and or type 2 diabetes, swelling in your arms and legs, joints and muscle pains, enlargement of breast tissues in males, and increased risk of cancer. Here are some of the sources I used to get this information. I hope you guys enjoyed. Thank you so much for watching.